from everyone who's out there and where you're calling in from. So welcome, everyone. My name's Dianne Oickle, and I am one of the Knowledge Translation Specialists with National Collaborating Center for Determinants of Health. And you're here for a really exciting webinar on a new data module and partnership tool specifically around early childhood indicators. We have a few speakers whose voice you're going to hear other than myself, but I'll go through a couple of little housekeeping related things first. Please continue to introduce yourselves in the chat box. Also, if you've got any questions, we will have a question answer period at the end of the webinar that we will get to. So as you come up with questions, please post them in the chat box, and then I will bring them out and ask them to the participants when we get to the Q&A part. Please also know that this webinar is being recorded, and we will be posting it on the YouTube channel for later viewing within the next few days. And so you're hearing my voice right now, Dianne Oickle. You should also know that in the background is our brilliant research assistant, Danielle McDonald. She has helped set up the technology. She was the one you heard from who sent out the slides and with all the registration information, and she's put her email in the chat box in case there's anything that comes up for you that you need assistance with during the webinar. And as many of you know, we are one of 6 National Collaborating Centers for Public Health. We are located in beautiful Antigonish, Nova Scotia. We have our NCC for Methods and Tools that's in Ontario, Hamilton, Ontario. Healthy Public Policy is in Montreal. Infectious Disease is in Winnipeg. Our NCC for Aboriginal Health, Indigenous and Aboriginal Health is located in Prince George, BC, and our NCC for Environmental Health is in Vancouver. We all have specific scopes and focus, but we also do some things collaboratively as well. What I would like to most importantly start with is acknowledge that the NCCDH is in Mi'kmaq, the traditional, ancestral, and unceded territory of the Mi'kmaq people. We do this acknowledgement and have moved to making this part of our regular practice with webinars. We also do it as part of our presentations, whether we're local or whether we're in other locations. And as well, we're putting an acknowledgement on our printed products as recognition and reminder to us all that we're all treaty people and that we all have a responsibility to dismantle those colonial practices that are still in place. And as you know, we are National Collaborating Center for Determinants of Health. This is a little bit about our work. You will find at the end of the slide deck a connection for information on how to connect to our website and the different tools and resources that we have there. So now we're going to go to a poll. And Danielle, are you able to move that out into the middle? We'd like to just see where everyone's from. Where are you calling in from, or where do you work? What is the focus of the work that, or not the focus, sorry, the area of focus, the geography of focus for the work that you do? This is really interesting. So no one from Yukon. We do have Manitoba. No one from Nunavut, unfortunately. But we have someone from PEI. No one from it looks like we have every province today. So that's really exciting. And one of the territories. So we'll be sure to reach out to our colleagues after the webinar today, our colleagues in the Yukon and Nunavut, and make sure that they have access to the information as well. This is great. Thank you very, very much, everyone. That's exciting. And on to today. So these are the objectives that we used to develop the webinar today. And these are also the objectives that we'd like you to refer to at the end of the webinar. We'll be sharing an evaluation link with you. The evaluation survey literally takes about 2 minutes to do. It will not take long at all, and we'd like you to reflect on these objectives to do that evaluation. And really, we're highlighting this amazing new data tool that's become available, and we're really hoping we can get at some of that discussion about the practical implications and how we use this data when it comes to planning and implementing public health programs. So a few things to highlight from our own resource library. At the top, you'll see or actually at the bottom, you'll see the web address for our resource library in general, but there were 3 things in particular I thought might be useful related to our discussion today. One is a document from our colleagues at the CICH, the Canadian Council for Social Determinants of Health, and this is a review of frameworks on the determinants of health, and in particular highlighting a few that are thought to be particularly useful and applicable to public health practice. We also have a fairly new document on some practice stories about collective impact in public health, and these practice stories are early childhood in focus, and so I thought they might really be interesting to reflect on in light of our conversation today around early child indicators. And as well, I think this document is 2016, our Equity Integrated Population Health Status Reporting. And this offers a framework for public health practitioners who are using data and indicators to integrate equity into their population health status, community health status reports. And really this framework centers knowledge mobilization at the middle of any population health status reporting process, and being able, or the necessity of thinking about that and considering that from the very beginning of that process. And because we're talking about indicators, there may be something from that it becomes applicable to your own population health status reporting process. And we have 3 speakers today that are on the line. We have Christine Soon from the Public Health Agency of Canada. We have Louise Hanvey from the Canadian Institute for Child Health, and we have Shelley Callaghan from Canadian Institute for Child Health. I'll introduce Louise and Shelley in a little bit, but right now I'll move and turn over the speaking reins to Christine Soon. So Christine is a Senior Policy Analyst in the Centre for Chronic Disease Prevention and Health Equity at the Public Health Agency of Canada. And her work really focuses on advancing health equity through leveraging action both within but beyond the health sector, because we know that a lot of the solutions to equity issues and social determinants of health lie outside of the specifics of the health sector. And so the work is focusing on improving the conditions where we live, learn, work, and play. Her previous work has really focused on policy development, community programming, knowledge mobilization related to communicable disease prevention. She holds a Master's in Public Health from the School of Population and Public Health at UBC, and her focus was on adolescent sexual health. So with that, I will turn it over to Christine. Are you ready to go? Christine, I don't know maybe if you're muted. Can you try unmuting?
Hi, I'm here, and thank you for that introduction. Can you hear me?
Yeah, I can hear you great now. That's great. Thank you.
Great. So I'm really happy to be a part of this afternoon's webinar, and I wanted to take about 5 minutes to provide a bit of background and context in terms of the work related to advancing health equity at the Public Health Agency of Canada and some of the origins for this collaborative project on early childhood development. So the Public Health Agency of Canada advances health equity and the social determinants of health through collaboration within and beyond the health sector to address factors and conditions which underpin health inequalities. One intersectoral mechanism is the Canadian Council on Social Determinants of Health, the CCSDH. So this council has played a key role in providing advice to the Public Health Agency of Canada and leveraging action on the social determinants of health. So since its inception in 2005, the CCSDH has been very well positioned to strategically contribute to Canada's global and national role in advancing action on the social determinants of health, which is consistent with the Rio Political Declaration on Social Determinants of Health. So you can see here that the Council is a collaborative group of leaders from diverse sectors across Canada. And so this ranges from healthy child development, social development, urban planning, business, and labor, for example. The most recent phase of work for the Council has focused on social determinants of health for healthy child development, including a component on Indigenous children and families. We are currently in the process of refreshing the Council's mandate and membership. And so for more information about the Council and our work to date, you can visit the website listed at the bottom of the slide, www.ccsdh.ca. So over the past few years, the Council has set a foundation to advance the determinants of health through a number of activities. So here you see a range of reports and synthesis on really focusing on the social determinants. So as an example, the Council has contributed to changing the discourse for greater impact through a document called Communicating the Social Determinants of Health, Guidelines for Common Messaging. The Council has also worked to highlight successes relating to challenging social determinants of health issues through a report called Roots of Resilience, Overcoming Inequities in Aboriginal Communities. The Council has also demonstrated how data can support intersectoral action on the determinants of health through a document called Maps to Inform Intersectoral Planning and Action. And as highlighted earlier, we have also worked on a frameworks document that includes an analysis of 37 frameworks on the determinants of health and an in-depth analysis of these frameworks to better understand how to leverage action across sectors. Now, more recently, recognizing that action on early childhood development and on the social determinants of health for Indigenous people are two key areas where progress has a potential to really improve health equity in Canada, the work has focused on advancing social determinants of health and addressing health inequalities in these two areas. So in 2015, a working paper called Improving Healthy Child Development, Building Capacity for Action, laid the foundation for this current project. The new resources, which will be discussed today, are the direct result of this work with the Canadian Council of Social Determinants of Health Healthy Child Development Task Group. And key findings from this report identified the need to develop a platform to share evidence, integrate and coordinate evidence across sectors, and with a focus on children ages 0 to 5 years old. So the project of focus today, funded by the Public Health Agency of Canada, and is a collaboration with the Canadian Institute of Child Health and the Canadian Council on Social Determinants of Health. The objectives of the project were to develop a web-based, user-friendly resource to consolidate early childhood development and Indigenous ECD data on children ages 0 to 5 years old, to also profile intersectoral initiatives that have effectively used this data to inform program or policy, and to develop an online tool to help facilitate partnerships and intersectoral action across sectors. Thank you.
Hi, sorry, I had muted myself. So thanks very much, Christine. I really, really appreciate that. That was a really good overview of the project and the history and where it came from. And so with that, I am going to turn the speaking reins over to Louise Hanvey and to Shelley Callaghan. So Louise was principal researcher and author of the first and the second editions of the CICH profile called The Health of Canada's Children. She's research director for the fourth online edition of that tool as well. She supervises the synthesis in partnership with principal investigators and co-investigators of each of the profile modules and oversees translation into clear language so that it'll be published on the portal. She's focused on children and youth with a particular focus on health throughout her career. She has extensive experience in project management, research, writing, group facilitation. She's pretty much about done it all, I think. Her research experience includes survey research, conducting analysis, large national data sets, qualitative and focus group research. She's an RN, and she also has a master's in health administration with a really huge variety of experiences. And Shelley Callaghan is project manager for this work with the Canadian Institute for Child Health. She's also in private consulting. She's got extensive project management experience. She is responsible for the day-to-day operations of this profile, including that she oversees the portal, the communications, partnerships, budget management, research, writing, knowledge translation. She's a team leader for the 5-year report team, and she's been working in the area of child-youth health, physical activity, health promotion, and a wide variety of public health programming areas for over 20 years. She's facilitated lots of national meetings, consultations. She was part of meetings with the current Healthy Child Manitoba 2017 review. She has a Master of Art degree and also a Bachelor of Social Science degree, and a variety of experience in education. So thank you very much, Shelley and Louise, and I'm now going to turn it over to you.
Great. Thanks so much, Dianne and Christine. I appreciate this, and it's very exciting that we have so many people participating in this webinar as we launch this newest module of the profile. So what I'm going to do in the time I have with you is I'll give you a little bit about the background of the profile and how it is put together. I'll talk to you a bit about some of the ways that the profile has been used, and I'll talk to you about the strategy for identifying the indicators and the data for the module that we'll be looking at today. So the first issue of the profile of the Health of Canada's Children was actually launched in 1989, a long time ago, and it was a book. And it was interesting. For those of you that don't know, the Canadian Institute of Child Health is a national nonprofit organization focused on promoting the well-being of Canadian children and youth. The Institute's always taken an ecological approach to healthy child development. Right from the start, the founders of the Institute recognized, that it wasn't the healthcare system that kept children healthy. It was the environments in which they, grew and lived and played and learned. And so really they talked about the social determinants of health long before anybody used the determinants of health language. And the Institute did a lot of advocacy work, and in the late 80s, the board decided that, we really, every time an issue came bubbling to the top, someone brought it to our attention, we needed to go scrambling to find the evidence to inform us as to how to act on that particular issue. And so they started to look at the concept of developing, a publication. We didn't call it a database in those days, but a publication that would describe in sort of broad description of children's well-being. So we headed off to Stats Canada and with a list of questions, many of them relating to the social determinants of health, and said we're looking for data and evidence on all of these things. And the person there said to me that those are really good questions. We can't answer them. We don't have the data to answer those questions. These are the data that we have. So in the first issue of the profile, we brought together as much data as we could that looked at the social determinants of health. For example, we did have a full chapter on low income and poverty. We looked at family structures. We looked at culture and diversity. We looked at access to early childhood education. We looked at labor force participation of parents. We looked at violence in communities. But we also focused on the gaps, the things that we didn't know, because there was a lot, particularly about the social determinants of health, that we didn't have any data about back in '89. If you look at that first edition, you'll see there was a lot of data on death and disease, not a lot of data on health and determinants of health. And so again, as I said, you know, the profile highlighted this and said we really need to focus on the things that help make children healthy. So then we moved on to the second and third editions of the profile, which were again books. And I might say, and we'll talk about this as we talk about this module in early child development, but we always focused on bringing data to people's attention in a very digestible, clear way so that people could actually see it, understand it, and use it. And those were our goals. And so with the second and third profile, we continued with sort of those overall guiding principles. And as more data became available to us, as there were surveys about children's health, as there were more extensive data collections at Stats Canada, we were able to look at other issues affecting children, such as mental health, the health of Indigenous children and youth, which was a focus area in the second edition of the profile. And again, we were able to look more specifically at the social determinants of health. So this fourth edition of the Profile of Children's Health was actually launched in 2014. It's electronic, it's online, you can download things, you can search, it's all found on one portal. It allows us to update the data in a timely fashion. As you can imagine, in the first three editions, we were publishing books. That takes a long time. We can include more easily emerging issues. We can quiz people. We can get immediate feedback. It gives us a lot more flexibility. But it stayed true, and I'd like to say that after every edition of the profile, we did an extensive evaluation of the usability and to what extent we could, the impact of the profile. And, you know, one of the messages that came through loud and clear was we like the format, we like the simplicity, and it makes it easy for us to use. So we kept, we kept true to that goal, and also obviously we were presenting evidence-based data. We were, using a knowledge translation focus, and we were identifying emerging issues. So just sort of, if I can outline these four important principles of the profile for you to keep in mind. So it's a combination of analysis, primary analysis on existing data sets. And, if you look on the profile site, you'll see in detail, what our guiding principles are, how we determine indicators, how we determine data sets. But, we do work with population-based data sets. Our first goal is national, then provincial, and at times we'll use regional or local to highlight an emerging issue. We also use published findings, so findings that are published in peer-reviewed journals as well as government reports. We have always taken a developmental approach in the profile and also focused on specific issues or specific populations. As I mentioned, Indigenous children have always been a focus of the profile. As issues emerge, such as mental health, children's environmental health, we focused on those. We've always addressed the determinants of health, and we've always included data on health outcomes, and it's always child and youth centered. So the development of the profile, it's very much an iterative process, an engagement process. When we always form an executive advisory, expert advisory committee to guide us. We're not the experts in every content area, so we're guided by the experts. And so we collaborate with people who know either the specific developmental area or the specific issues that we're identifying. And that advisory committee identifies the issues, the indicators, they advise on content selection, they advise on all our data sources, they provide expert advice to ensure the rigor and the integrity of the research. They always review the content and help us with presentation. So again, this is always a collaborative of experts in the field. So who uses the profile? Through our evaluations, after the first 3 editions and then going into the 4th edition, we did quite an extensive consultation to determine, A, should we do this again, and B, who's going to use this information. And so we saw that, you know, a wide variety, as you can see in this slide, from governments to educators to NGOs. And how do they use it? This is really important. This is what our evaluation work told us. They use it to monitor trends in the areas they care about. They use it for education, for health professionals. It's also used for education in the, you know, the public education system and university system. They use it to develop policy, to further develop research agendas, prepare to set priorities for their organizations, to design their programs, so a variety of ways. Now, I'd like to take a couple of minutes to just share with you some stories, really, about how the profile has been used to shape public policy in a number of areas. And you can see the list here. I may not get through all of these because I'm cognizant of time, but I'd like to share some stories. So, right from the beginning, when we consulted with people as to what they wanted in the profile, what they liked about the profile, what they wanted to see in the future, the policymakers always told us that they needed information presented in a format that's quick to examine and easy to understand. Lengthy research papers written in technical jargon were not helpful for them. So they needed, you know, bites of information that they could count on, that were you know, evidence-based and went through a rigorous process, but easy to understand. So I mentioned that the first edition of the profile, which was in '89, had one chapter focus on child poverty. '89, you'll recall, was the year of the All Parties Declaration to eradicate child poverty by the year 2000. Clearly, we haven't done that. But there was a big focus on poor children. And so at that time, a number of NGOs got together, national NGOs that cared about kids. And so it was the Institute of Child Health, but other people like the Vanier Institute for the Family, the Canadian Council on Social Development. There was an organization called the Canadian Council on Children and Youth. There were sort of the startings of NAPO, the National Anti-Poverty Organization. So a number of groups that knew child poverty was an issue in Canada and wanted to know what to do about it. But in order to take any kind of collective action, they needed some data. So that was one of the, you know, the poverty data in the first edition of the profile was very, very helpful to that group, both in setting the context, so demonstrating what the issue was, but also looking at some of the health impacts that were being started, that we were starting to see discussed in some of the peer-reviewed journals. So that group eventually morphed into Campaign 2000, who have had, you know, been a large sort of policy watchdog, if I can say, that reports out on indicators every year now on children's poverty and continues to this day. The other area that the profile really led Canadian sort of policy and, you know, practice and movement was in the area of injury prevention. So again, you know, in 1989, we knew when we looked at the mortality and morbidity data that childhood injury was a big problem in Canada, was a big health problem for Canadian children. And so based on that data, and again, consultation with Canadian and international experts, the Institute convened the first national conference on childhood injury prevention. And we brought together governments, we brought together professionals that care for and about children, and we brought together the NGO sector and the private sector. So we brought all sectors together to talk about childhood injury prevention. And, you know, there have been a lot of developments over the years that have come after that. And, you know, some specific things that the Institute did using the profile data and injury prevention was to develop a coalition on bike helmet use that, again, lobbied and was successful in getting policy change in many provinces at the provincial level. Also, the Institute used the data on childhood injury to work with provinces on infant and child restraint system, policy and legislation, and finally, we did a lot of work with the Canadian Standards Association for changes to childhood playground standards. And I think the last one I'll talk about, just in the interest of time, is children's environmental health. So I believe it was in the second edition of the profile, the Institute recognized through our collaborative work with experts that the environment, children's environmental health was becoming a big issue. And so we looked for data in children's environmental health to include in the profile. And again, it was like the 1989 story. There wasn't a lot of data available. And so we sort of talked to experts, looked at peer-reviewed papers, and included a lot of information in that profile that was sort of more general in nature, all sort of premised on the precautionary principle. And as a result of that work in the profile and our work with partners, because as I said, it's always a partnership, the first national or global forum for action was held, a conference to look at children's environmental health. And actually the first one was a national one in 1997, and it looked at the impact of environmental toxins on children's health. And then we went on to collaborate on a global forum in 2001. And then as a result of that, there were a number of initiatives that the Institute took on. One was working with the federal government on policies around lead and gasoline, et cetera. So I think these three examples show us clearly what the evidence brought forward in the profile allowed us to do to further, the work in policies in very important children's health issues like poverty, injury prevention, and environmental health. These are just a few quotes of what people have told us the profile means to them. So, it's a useful tool for planning, and I think, and that's from a United Way, and I think, as I said at the beginning, people find the presentation of the data easy to use. At the local level, it also gives people ideas for the kind of data they can look for in their local communities. And it also provides them the opportunity to explore ways that they can work together. This is one of the important quotes, I think, because it addresses the issue of how this profile brings together in one place a lot of information about children's health and well-being. So it's a place people can go to if they're looking for information, to get a lot of information and then to be, referred on to other sources if they want to go further. And, we partner a lot with healthcare providers, organizations, in developing the profile and in assisting people to use the profile. And the College of Family Physicians is a good example. And again, the profile provides the information, not just relevant information, but information that they can use. And I had to include this recent feedback we've had on the early childhood development module because, again, I think it reiterates that people are finding this useful. So I'll move on now to the module that we're talking about today and that Shelley is going to demonstrate for us, just to talk to you about this module and what you're going to find in it. So this module focuses on health and development in the early years. And the module presents evidence-based data, as I described before, with links to the original sources. So if people want to dig deeper, they can go and find more information. We provide summaries, so there's a lot of data, there's a lot of information in the chapters, but in order to help people get their heads around it, there's summaries so that they can identify what's important. We have included in this module implications so that we can further elaborate. So what? What does this mean? Why is this important? We link to other websites, to other reports, again, if people want to dig deeper. This module is tracking trends, and that's very important. And as I said, we're continuing to identify gaps in knowledge. So information that we know would be very useful to have, but that we don't have at this point. Now, Christine talked about the partnership that was involved in developing this module. And the module is based on a number of primary data sources, and I've listed some of them here. So the census, national surveys such as the Community Health Survey, the General Social Survey, the Canadian Health Measures Survey, the Survey of Young Children and NLSCY, maternity experiences. We use vital stats, we use labor force stats, we use Justice Canada stats, and international databases like OECD and WHO where they're relevant. And as I mentioned, we also use published reports. So what will you find in this module? There's 8 sections in the module, and they focus on the social determinants of early childhood health and development. And they also include, Section 7 and 8 also include information about health outcomes and developmental outcomes, and tie them back wherever we can, wherever the evidence lets us, to the social determinants. So in the contextual and demographic information, you'll find information about the population of children, how many young children are there, where do they live. You'll find information about diversity, many aspects of diversity, and information about the family. What do families look like that young children are living in? How are they structured? How are they, where are they living? Section 2 looks at income and labor market. We know they are particularly critical social determinants of young children's health. So we look at income, so median income, income by different family types. We look at low income and poverty. We look at labor force participation. We look at housing adequacy, access to housing. We look at education. We look at food security and food insecurity. And we look at child benefits and child assistance. Section 3 looks at family, so it looks more, in Section 1 we describe the family, but in this section we look more at the context of the family because we know that families and the way families nurture and care for their children are tremendous determinants of their health and well-being. So we look at health of mothers and fathers to what extent we can, although there's far less data available about fathers. We look at certain behaviors of parents. We look at parenting styles and parenting approaches. We look at family functioning, and we look at violence in families and issues relating to child welfare. In Section 4, we look at the community in a very broad way. So we look at young children's participation in recreation and community life because, again, we know that that has an impact. We look at their access to green space. There's emerging evidence around the importance of children's access to green space and outdoor play in their healthy development. Obviously, we look at education, early childhood education and care, and we look at it from a number of aspects, the availability of early childhood education and care, the cost, what families are using. And we also look at community safety and cohesion. So things like crime, and also parents report of how cohesive they think their communities are, how safe they think their communities are for their children. We also look at health services because we know that health services are one of the determinants of children's health, and in that area we look at utilization of prenatal care, of postnatal care, of access to healthcare professionals. We look at screening because we know screening for young children is very important, so hearing, vision, developmental screening. We look at dental services. We look at, how many young children are accessing dental services. We look at the issue of early childhood caries. We look at costs related to dental care. We look at genetic services, knowing that those services are critical to young families. So, availability of professionals like geneticists and genetic counselors and labs. And finally, we look at immunization. So we look at sort of the status of immunization amongst young children. The environmental risks and conditions section is based, as I said, on the precautionary principle, which is very important for children because children are particularly vulnerable to environmental toxins for a variety of developmental reasons. And so we look at exposure to toxins, things like lead, mercury, BPA, and the Health Measures Survey has enabled us to explore some very interesting data there. We look at air quality, so fine particulate matter, ground level ozone, environmental tobacco smoke. We look at water, climate change, and then we look at some outcomes that have been linked in evidence to environmental exposures, things like asthma, some neurodevelopmental and neurobehavioral issues, and some congenital anomalies. And then, as I said, we always look at outcomes. So we look at health outcomes and developmental outcomes for young children. So those include birth outcomes. Those include mortality, perinatal mortality, infant and child mortality. It includes injury. It includes children's participation in physical activity. And it includes some morbidities like cancer, asthma. It looks at mental health to the extent that we have data, and disability, again, to the extent that we have data. And finally, we look at developmental outcomes. The EDI, the Early Development Instrument, has enabled us to get really good evidence about children's early development. And we had experts from the Offord Center on the expert committee, so that that enabled us to utilize the data and utilize it, correctly. And so we look at vulnerability and we look at school readiness. So that sort of in a nutshell tells you about, what the profile is, where it came from, how it's being used, and what this module will give you. And I'd like to end by saying there's a lot of data in this module, but we also identify what we don't know, because there's a whole lot more that if we knew it, it would help us with children's health and development. So the early years module provides, now Shelley, is this where you take over, or am I continuing?
Shelley, are you there?
So this module provides us with easy access to the data portal, evidence-based information, as I said, links back to primary sources and resources and websites, trends. We also have innovative initiatives, which Shelley will talk about, and everything in the profile is downloadable as a PowerPoint. So if you wanted to take it away and use it, you'd be able to do that, and Shelley will be demonstrating that for us. So now I think it's time to pass it on to Shelley. So thanks very much.
Shelley, are you there? You might have to unmute. We'll just wait 1 second for Shelley. I think Shelley's still muted up. So if you press *6, Shelley, you should be able to ring in. Oh.
Okay, can you hear me?
Oh, we can hear you now.
Oh, weird. Okay. Okay, great. Sorry, everybody. Louise, thanks so much, and Christine for providing such a great overview. Mine is going to be much more of a technical presentation to let you know a bit about this online module. So just to give you a sense, when you're on your phone, for instance, this is wonderful because it's actually mobile friendly, the profile, as well as you can see it on your computer screen and your tablet and everything. So when you get onto the main site of the profile, this is what the landing page will look like. And right at the top are a number of little bars where you can check out your menu. So this is generally what you're going to get when you first come on to the profile landing page. You will then see that there's a number of different modules that are listed in a bar, and you can go exploring them. So we're talking about the Healthy Child Early Years module here, but there's a number of other modules that we have published as well. So you can just scroll through and pick the one that you want. Oh, what just happened? All the questions just popped up and I don't see my screen anymore.
I am actually not sure. Danielle, are you there to help us out here? Well, maybe you can just keep talking, Shelley. People do have the slides in front of them if we need while we fix it.
Okay, I don't see the slide, so.
Oh, sorry. Okay.
It
looks like it's being sorry
okay,
about
there
this, everyone.
There we go. Yeah, great. Okay, so when you actually go on that bar where you see all the different modules, you will see that this pops up with a hover feature where you can go directly on the module you want to go on, and then you just click on Go to Module. So it's fairly easy to get to where you need to go. When you actually get into the module, then it goes into all the sections that Louise has already gone through, and then what you will see is the different types of data pieces that are going to be there. So as you can see from the slide, I just gave you an idea of what would be in section 2.1 with income, and these are just 3 examples where you can see after-tax income or, you know, couples with children, and you basically just click on that, and then you'll go directly to the data piece. So when you click on these data pieces, what you're going to see on every single slide, which we've tried to make this really consistent so it's easy, is the data itself. So you'll see it in either a table format or maybe it's in a bar graph or a pie chart. The source of that will be right underneath, and there's a link to the actual data source as well. So if you want to go to the actual source, you can do that. To the side will be a description box, and some of these description boxes are longer than others, but really what it highlights is what is important about that data. Certainly there might be things when you look at it that you might think are important, which is great. I think that it's wonderful, our perspectives, how we look at data, but this will give you a little bit of something to really highlight. Then finally, there's a box underneath, and it isn't there for every single graphic, but when there are implications for the data itself, it is just right underneath that data. So this is generally what you'll see on every single page. For those of you that are familiar with the printed publications of the profile, what we've tried to do is create the exact same format, but in an online way. So you can see that there's buttons at the very, very top of the description box that allows you to see the previous data piece. It allows you to move on to the next one. So we actually developed this so you could almost read it like a book if you wanted to, but you can also go to that table of contents and just go directly to the data that's of interest to you. So that's how we've set up the format itself. In terms of navigating back, so when you've actually clicked on a piece of data that you want to see and you want to go back to the module, you can see there's kind of a running links that are right at the very, very top of the screen. So that allows you to go back to the home page. It allows you to go back to all the different modules. You'll be able to go back to Module 8 itself, or this particular one is from Section 6, so you can just go right back to the table of contents for Section 6. So you can either do the previous or next, or you can jump right back to maybe where you want to go. And this is an example of how you will see this on a phone. So as opposed to the website page, which I showed you before, the phone will actually be a scrolling piece. So you'll see the data first, you'll see the source, you'll see the description, and then underneath that you'll see any implications, and then the buttons are after that in terms of going to the next or the previous page. So this is some of the challenges and the exciting things about having things be mobile friendly, but really this is just so you can see how you're going to see things depending on whether you access it from your computer or from your phone. So the next item that I want to talk about, what's been very unique to this particular module, is that we've worked on some innovative examples. And so what we consider innovative examples are really interesting things that have happened because the data have pointed us in a direction. So, you know, when we look at some of the ones that we've highlighted, we're talking here about the Canada Child Benefit. We're looking at the ACE scores, and that is obviously a new and developing area that we wanted to highlight. There's the you know, all of the initiatives that have happened with childcare in Quebec, and just in terms of how they've done things, just so that we can all learn how they've used their data to really advance childcare services in that provinces. We talk a lot about injury prevention, and Louise talked about how much that has really expanded. There's a whole new data tool that we've highlighted here because if you want to go further into injury prevention, it's an excellent new tool that you can use. We also have highlighted some really creative resources that are really in this age group, kind of the 0 to 6 age group, around injury prevention. The EDI, the Early Development Instrument that you, I'm sure, are well aware of. You know, just there's some really new tools that have happened with that. And then there's a lot of things happening right now on outside play. So we're looking at having some things there. So just to give you an idea of how the innovative examples are presented. So here is the piece on the Canada Child Benefit. So what it does, usually we have commentary from experts, like this one is from Martha Friendly, and it talks a little bit about the issues, and it provides links to some interesting areas where they've used data to really advance this issue. Here is the one that's on the EDI, so the Early Development Instrument. And again, there's a really fun video that has just come out from the Offord Center that talks about the EDI, but we've also explained a little bit about how this particular instrument and the data from that can really help in the work that you're doing in early child development. And then this is an example of the injury prevention tool that has just been developed, the Injury Data Dashboard. So this provides links to it and talks a little bit about it. So again, these are just some of the innovative practices that are examples that we've highlighted. And they're really quite interesting to go through, as well as the data that's in the module. The last item that I wanted to lead you through is one of the things that we're always challenged with is how we get people to use the data and actually go deeper into the profile. So one of the fun ways that we thought we would do this is developing an early childhood partnership tool. And I'm just going to, and hopefully this will work, I'm going to go on to the live version of this. So I just share my screen. And here it is here. So what this early childhood partnership tool is, hopefully everyone can see this okay, is a series of 4 questions. And what you do first is you talk about what your role is. So for instance,
Shelley, just so you know, it's still loading for us.
Oh, it is. Okay, great. I'll just wait till it loads.
Well, keep talking. Just so you know, we can't actually see it yet. It may or may not load, right? So carry on. It's okay. It's okay.
Okay, great. So what you're able to do is basically indicate what your role is within the organization. So we have things like whether you're a teacher or a child care provider, or you work in research, or you work with a not-for-profit organization. We then ask you a series of questions in terms of what you think the key issues are with to help young children and their families and their community. So you just click on the ones that you like. There's things like affordable child care, there's physical activity and cultural opportunities, maybe it's unemployment or poverty issues, maybe it's environmental issues. So you just click on the ones that you want to see. And then you talk about some of your key challenges. So maybe it's lack of information, maybe it's funding, maybe it's policies. And then the last piece is we actually have a full list of different kinds of stakeholders. So whether that be schools or child care centers or universities or corporations. And basically what we ask you to do is whether you currently partner with them or not. And it's just an easy yes, no answer. So after you click on these items, you then just click on to get your results. And what it provides you with is a bit of a summary page, which I'm guessing you still can't see this, right, Dianne?
No, but Danielle's put the link up in the chat box.
Okay, great. So what you then are given is some links to the data based on your issues and based on what you said, the area that you're working on. It also talks about some resources you can go to help with some of your challenges. Then there's a number of partnership ideas on whether or not you currently are partnering with different groups like public health or corporate, or if you are not currently partnering with them, there's some ideas on how you would partner with them next. The final piece of the recommendations provides you with a series of links on where to find additional data, where to actually find really interesting tools on how to meet your partners, and then where you can kind of evaluate your activities, because we're always looking at how we can kind of see how partnerships are working and how we can do them better. So there's some tools there for you for that as well. So that is the Early Childhood Partnership Tool. Certainly every time you click on a different item, you're going to get a slightly different answer, but the idea is to really start to get you into the issues and the data and provide you with a bit more information to move you forward in this area. So that is, you can take away my screen. That's the end of my presentation, so thank you. And Danielle, you can go back to your PowerPoint.
That's great. Thanks, Shelley. Thanks. That was really, really great. I'm sorry, everyone, that it didn't work for us to actually watch the demonstration of the tool on the screen, but Danielle has put the link to it in the chat box, and certainly it should be in the PowerPoint as well, so we'd love if people went ahead and explored it. So now we do have some time for questions, and we've got a few coming in. If people have more questions as we start this part of the discussion, please feel free to put them up in the chat box, and I will pose them to the speakers. So the first one, I'm just going to go back a little bit here. The first question was really a bit of a comment, but wondering if you can comment on data from the Maternity Experiences Survey. So there was a comment that it was curious that it was included because the data is quite old. It's more than 10 years old. Can either of you comment on that?
Sure. For those that don't know, the Maternity Experiences Survey, this is Louise speaking, by the way, was a post-census survey. So it was a population-based survey of new mothers with babies less than 6 months old. And it was the first time in Canada that we had actually looked at the experiences of women during pregnancy, giving birth, and postnatally from their perspective. There'd been examples in other countries of similar work, but we hadn't done it in Canada. And this came out of a collaboration through the Public Health Agency of the perinatal surveillance system and some of the leaders in Canada that served on that group that wanted this to happen. And so it is 10 years old. You're absolutely right. It's never been repeated. So it was the only source of data that we had. This is another good example of really important information that's not collected on an ongoing basis and we don't have access to. One of the reasons that the group decided to use it anyway was that some of the sort of studies that have been done of women's experiences and of policies surrounding prenatal care and childbirth have indicated that change is very slow in our country as well as others in terms of addressing evidence-based policies, et cetera. So the decision was made to use that data, recognizing its age, because it was all we had. It hasn't been repeated, and the issues are still quite relevant.
Okay, that's good, Louise. Thank you for that explanation. We had a question. Is there a plan nationally to gather ACE scores and report this in the profile? So ACE is Adverse Childhood Experiences scores.
Right. So in this edition of the ECD module, we do have, we did present data from the Alberta sample, and we also, in the innovative examples that Shelley talked about, we included ACEs as an innovative example and described what it is and why it's important, and then provided the links to back to the sources. So in terms of plans to gather it nationally, we would not do that. As the Institute, we would certainly support that, and hopefully the focus in this profile will help bring attention to that. If national data become available, we would absolutely want to include it. in updates to the profile.
Oh, that's great. Thank you. So we have a question about the EDI scores. So are there innovative, do you know of innovative examples? Oh, I lost my question. Innovative examples of how to intervene when multiple domains of the EDI are low. So when there's high rates of vulnerability, for example.
Yeah, that's a great question. And again, we didn't get into that detail in this module, but we do provide links to, for example, the work that the Offord Center is doing and the tools that they're providing. And also we have, links to other jurisdictional reports that have used the EDI, how they're using it, sort of, what they're doing with it. So hopefully we've provided some access to people that are looking at addressing vulnerability in, either one or all of the domains by providing these links to the experts that are actually doing that work. And again, as that kind of information comes forward, and certainly people listening to this call, we would urge you to send in, to PHAC innovative examples that you know of that you didn't see here that would help people and that could be included in the portal. So I don't know if I answered your question. I guess the short answer is we don't have the answers, but we want to connect people to the answers.
Yeah, okay. No, that's very good. Thanks. So the next question is, are there examples of community interventions specifically focused on increasing pro-social behaviors, EDI, in children?
Honestly, this is terrible to admit, but I don't think so, and I don't completely remember all of the community examples that we linked to. So I think again, because we use the Offord Center in our innovative examples and the work they're doing there, that kind of information would be best accessed through them. They may or may not have it. Obviously, they've done a lot of research on, interventions to address vulnerability and school readiness, but I don't think we have anything in the module to that detail. Right. Again, just the links back to the Offord Center.
Yep. No, it's good. Thanks. And someone has a question around what's the capability for jurisdictional analysis?
So with some of the indicators, there is ability to look at it by province and territory. And again, we provide the link to the data source so that where that exists. In some cases, we did primary research on data sets, for example, the health measures survey, so we can only link, we provide our information, but we can only link to their published reports. But where we can, we link back to the primary data source so that people can look at it in terms of the provinces and territories. We do include some jurisdictional comparisons in the module, but again, people can go deeper if they follow the links. And then for some indicators, we don't have, even at the level of province and territory. We couldn't look at the data because the data would break down when we would start to look at it in terms of the small age group, and then, the smaller provinces, we would run into sample size issues.
Yeah. So it depends, right?
That's the short answer. It depends. In some cases, it's right in the module where we could. In other cases, people can go deeper by following the links, and in some cases, we just couldn't do the comparisons because the numbers didn't allow it.
And am I right, this is Dianne, and now I'm just thinking out loud, but am I right that that's one of the challenges around data in general, especially data around, equities and some of our public health focus, right, is that some areas, some geographies just don't have the numbers in terms of to be able to do that cross-jurisdictional analysis.
Exactly. So when we're looking at national surveys, unless they were oversampled and, built up the numbers, in many cases, when you start looking at children from 0 to 6, so you're looking at a very small proportion of the population, the numbers would start to break down. And that's a data gap. And, the survey of young children is not ongoing, and that's again, we've been involved in a number of initiatives to, bring that to people's attention and try and change that. But unless you sample a good enough size, and then if you try to look at it in terms of jurisdiction, different population groups, Indigenous children, children who are new to Canada, refugee children, it becomes very difficult.
Yeah, no kidding. And I was just part of a discussion about indicators back in February, and one of the things that this group had said to me is even when you're dealing with amazing tools like this, that there's still a community context and community-produced data that's not reflected. So even in areas where there might be a large data set available, it's not necessarily not that this is a negative, but there's a whole other piece of knowledge that comes from the community context, and that, is there a way that public health can engage the community to actually generate some data and that generate some indicators that, might sort of expand on the meaning? Does that make sense?
Yeah, absolutely. And, after the third edition of the profile, we actually did a series of community workshops where we went out with the profile sort of as a framework and a model and worked with, communities that were interested to say, okay, these are the indicators we've identified. What kind of data might be available in your community that would be useful to you, to do the work that you're doing, whatever that might be with children and youth. And the focus wasn't just on young children with that profile, but that was very, very, a very useful exercise. And over time, there was a data sharing strategy that came out so that communities could get access to data sort of at a more reasonable rate, if I might say, things like census data at the postal code level and that kind of thing, because obviously there's cost involved to a lot of these data, and it enabled communities to look at the indicators within their own community. And then, as you said, communities have data that we don't have nationally, that's not rolled up nationally. So when you were talking about the maternity experiences survey, sometimes at the community level or the provincial level, some places are gathering some interesting data on, maternal and infant health services that they can use within their own communities.
Right. Thanks for that. So we have one more question. Is there any potential to add physical literacy indicators to the EDI?
Well,
or is that a bit out of your
I think that's
out of your control,
an
right?
offered center question. But certainly, again, if those kinds of indicators were added to the EDI, that would be something we'd be very interested in including in the profile data. I know that the Offered Center is always looking at sort of, the relevance of the EDI and using the EDI and new communities that want to use it, et cetera. So I think that's more of an Offered Center.
Yeah. Okay, I'm just going to check the chat box here. Oh, we've got one more question that's come in. Is part of the initiative to help connect Canadian researchers that are interested in maternal early childhood health?
Yes, absolutely. That's a really good question. And, the process that we go through to identify our sort of expert advisory groups and work with experts we really do sort of shake the bushes, if I can say, to find out, who are the established experts and then who are the emerging experts and who are people that are interested in working in the area. Something I didn't mention about some of the other modules that you'll see when you go on the portal, the recent modules, modules for immigrant and refugee children, the module for Indigenous children, the module for genetics. These were all done as CIHR-funded initiatives, so we were able to put together a collaboration of researchers as well as practitioners, policymakers, because we always have an intersectoral kind of group in order to work on the module. So certainly it provides the opportunity for people to get engaged in the particular issue, in this case, early childhood development.
Right. Okay. We have a couple more questions coming in. Before I ask the next one, though, I know that sometimes people have to leave a bit early. If you do, I've put the slide up with the link to the webinar evaluation. So if you can please complete that before you go too far off today, that input is really, really helpful for us to plan future webinars. So that would be really great. Thank you. So we did have a question come in around the CAPC CPNP data that's collected by those programs. And so PHAC collects that data. Is any of that being utilized or accessed in this profile tool? So it's generally the data is broken down by service area, so some urban, some rural.
Yeah,
and it might
yes,
help
we
with
did look at those data, and I believe they're included in some of the descriptions. We did, in fact, look at those data.
Great. Okay. And is it, so that was one of the data sets, or it was?
Well, it would be from their published reports. So
right.
we wouldn't access their raw data, obviously. Something like that we would do from their published reports or any data that they had published online.
Yeah, okay, that's great. Someone's asking about the Offered Center and that they have tools to improve vulnerabilities, as you had mentioned. And so do you link to those tools through the profile?
Yes.
Okay, okay. Probably there may be people on the line who haven't heard of the Offered Center, so that would be an interesting one for them to look at.
Absolutely. And Dan Offord was a leader in child development in Canada. He was the principal investigator behind the first child health survey in Ontario, which identified particularly the impact of the social determinants of health on children's physical and mental health. And Dan became quite an advocate for children's well-being, and he based his advocacy obviously on sound data. He was the chair of our mental health module in the third edition of the profile, and Dan unfortunately died too young, and the center that he founded for children's development is the Offered Center at McMaster.
Okay. That's really nice to acknowledge him, and really a good site for us all to take a look at. Absolutely. So we've got another question. Do we have publicly accessible environmental scan data? So main stakeholders, initiatives.
Well, we do environmental scans in the process of working on the modules. On each of the modules on the profile. So we do an environmental scan on the issue of, what's published, who's doing what, et cetera, from organizations, government reports, et cetera. So we do integrate that into the information in the profile. It's not, we haven't published environmental scans on issues as a separate publication from the Institute. We just haven't had the resources to do that. Right. But certainly environmental scans as well as, literature reviews, systematic reviews are done.
Right. Okay, well, that's great. We just had someone offer in a comment about Dan on the chat box that he was a board member and a member of several advisory committees at CICH and involved for many years. So he's well known to
Absolutely. And he also, Dan was a psychiatrist, and in the summer, every July and August, he worked as camp director at Christie Lake Camp, which is in Eastern Ontario, and it's a camp for children for children who are poor and wouldn't afford to be able to go to camp, and it provides accessibility. Dan's, one of Dan's mantras was that it's really important for children to succeed at things and to develop competence in things, and so having access to camp where they could learn to swim and play certain games, and so he was known as Dr. Dan. And when I went to his memorial service in Ottawa, the church was full of Christie Lake current and past campers. So he really walked the talk.
That's really lovely, and it speaks to that the importance of those life experiences for kids.
Exactly.
And even if it is at a short-term camp, it's that seed and that skill that it plants in those kids, right, for what's possible.
And Dan, Dan really focused on equity, that each child should have the same chance. Every child should have the same chance. And, I mean, that's what spurred on the EDI so that they could look at how are kids actually developing and ready for school.
Yeah, yeah. There's another question. Is there part of this initiative to help connect Canadian researchers that are interested in maternal mental health, pre- and postnatal mood disorder, connecting early childhood health?
Yeah, now we didn't sort of purposely look to connect those people, but we did in fact explore that topic, right, because it's such a critical determinant of children's health. So we did, explore the literature and talk to the researchers and engage them in reviewing the profile. So it wasn't that we were sort of, that was our goal, but it was a consequence. But the other thing that, if I can just say, that the Public Health Agency is engaged in now is the revising of the national guidelines for maternal and newborn care in Canada. And that is very much a collaborative process, again, where they've brought together the key researchers and practitioners in Canada who are looking at various aspects of maternal and child health, maternal and infant care. It's more on the care side, but certainly they've brought together people who have focused on the mental health and well-being of mothers.
No, that's really important. We are at the end of our questions. I would like to, before I close off, though, I really want to acknowledge a few people that were part of putting this webinar together and who are silently in the background right now. And one of those people is James McDonald, who is Secretariat Member for Canadian Council for Social Determinants, and he's a policy analyst with PHAC, and also Janice Sonnen, who's Executive Director at the CICH. And they were both, this has been a real partnership putting this webinar together. And really the CICH folks did all the work in terms of the content and putting the pieces out there for everybody to learn from. But NCCDH was really pleased that we could work with everybody, and I just really want to acknowledge those silent partners and the role that everybody had in putting this piece together. So I think with that, do our speakers have any final comments that they want to offer?
I'd just like to say thank you very much for making this possible, and thanks to everybody for participating and joining us. And, if people have feedback, we're really always keen to get it. So please let us know what you think, and thanks again.
Yeah, for sure. And, I would echo that. And certainly if there are practice examples that people have of how data and modules like this have been used in public health work, I would really like to hear about that. So, let NCCDH know, and maybe we can share some of that back and forth as well. So,
great.
So I will thank you all. Shelley, I know, is off the line right now, but Christine Soon and Louise Hanvey for talking and doing this presentation today. I really, really do appreciate that, and I appreciate that you brought it out to everybody, and thanks to everybody that dialed in. The webinar room will be open for a few minutes, but we'll be closing it down fairly quickly, so just make sure to, again, tell us if you've got a group there and how many were there. Please make sure to fill out the evaluation survey. We really do use that information to help plan future webinars. It really does help us out, yeah, any and all comments are more than welcome. So thanks, everyone. I'm going to ask our speakers to hang up and dial right back in a few minutes. But to everyone else, have a lovely day. Thank you.
Thank you.
Okay, bye.